39-year-old woman presents to primary care physician for general checkup. She has not seen a primary care physician for the past 20 years, but now she states that she has been healthy during this time frame. She had breast implants placed when she was 28 without issue, but otherwise had no surgeries, no family history of breast cancer. She's just concerned about her risk for breast cancer because her friend was recently diagnosed with breast cancer. Temperature is 97, blood pressure is 114/64, pulse is 70, respirations are 12, and oxygen saturation is 98% on room air. Physical exam is unremarkable. Which of the following is the most appropriate workup for breast cancer for this patient? So remember, this is a 39-year-old with no family history of breast cancer, no medical history. Now she's just concerned that she needs a screening for breast cancer and she had a breast implant. So in a lady with breast implant, the routine screening is same as a normal lady without breast implant. So the workup in this patient is options are BRCA genetic testing, mammography, no intervention indicated at this time, sentinel node biopsy, and ultrasound. Since she's just 39 and the usual routine screening starts at 40, she also would need screening only at 40 because she has no family history. She just has a breast implant. So she can be undergoing mammography once she turns 40. So she requires no intervention at this time. BRCA genetic testing is for familial breast cancer if there is a family history of breast cancer in the first line individual, first degree relatives, or there is history of ovarian cancers, especially early breast cancer. Only in those conditions you would need BRCA genetic testing. Sentinel node biopsy is indicated in a patient who has been diagnosed with the breast cancer and there is no palpable lymph node. You just inject dye into the mass and see if the nodes that is draining the draining the tumor is affected with the cancer. So you just inject the dye and take the lymph node that stains with the dye, and then look for the tumor cells in the lymph node. If that is positive, you would have to remove the lymph nodes as well. It can be done during the surgery or prior to that to indicate lymph node dissection. After 40, you usually go for mammography. In young ladies with dense breast, that is when you do an ultrasound. So at this point, she requires no intervention.